Dear esteemed colleagues, I suppose that you should begin by saying words of thanks to the most stoic ones for participating in the last today's plenary session dedicated to the National Healthcare Project. And I would like to greet the participants of this session, the governors, Natalia, Komarova, Sergei Zhivachkin, Igor Vasilyev, and we're being joined by Dmitry, Azarov. Effectively, the previous plenary session laid down the bridge towards this session, and I would like to begin by saying that, of course, the power and the development of each nation is first of all defined by its human potential, by the health, by the industry, by the creativity of the population, and that is why one of the most significant national projects of these days is when the National Healthcare Project is being launched, which includes 8 federal projects, which were endorsed on December 24th, 2018. And like I mentioned during the previous session, as of July 2018, each of the 85 regions of Russia were the ones where, based on the regional specificity, we were working on various segments and components of both the national project as well as the federal projects which are part of it. And effectively, as of right now, the federal 85 regional projects do not look like each other because they are based upon the mapping of the density of the population in each region and in each municipality, upon their demographic and environmental peculiarities, the structure of the maladies and diseases, transportation practices. But against all these differences, all the regional segments are aimed at achieving the single objective, formed upon the singularity of principles and conform to a single understanding of the mechanisms required to preserve the health of the people, to prevent preventable mortality and extend life. Now, what affects human healthcare? The genome defines the health potential by only 15%, while the rest of the 85% are environmental factors which, through epigenetic mechanisms, affect the genome base. At the same time, the 15 to 25% come from macro and micro environment, the nature, the various industrial factors and productivity factors. The biggest contribution, at least 60%, comes from the way of life. That is food, nutrition, this is the activity, physical activity, the level of stress, the bad habits and destructive behavior. In this way, the maximum effect upon human health may be produced only by a human being itself, and for which purpose the contemporary healthcare additionally builds the system of informing the population and developing the motivational set of drivers to incentivize people to follow the healthy way of life and to avoid destructive behaviors, apart from it creating the opportunities for the human beings to pursue such a healthy way of life. Next slide. So in this way, the current healthcare paradigm is a transition from a passive participant in keeping up with the healthy way of life towards an active partnership in every individual case, whereby an individual should not only possess information but should actively utilize it, which is something that he or she acquires as a result of care. And that can be easily achieved in case an individual relies upon a proactive community that has support groups integrated into it, such as psychologists, social workers, and insurance representatives. And that is exactly the topic that a separate federal project has been dedicated to strengthen public health care in developing the stimulus towards a healthy way of life. This is one of the federal projects, which is the national project Demography, which is intrinsically related to the national healthcare projects and is being implemented under the aegis of the Ministry of Healthcare. Whereas our past was linked to treating the diseases that has already manifested themselves, the current is related to an early diagnosis of such maladies, and you see the extent to which in green colors we note that the possibilities to preserve health are increased. And this kind of future is aimed at providing support for healthy people, at continuous monitoring of the state of health, and it is aimed at forecasting, prevention, and healthy way of life. Now, what is it that every individual requires? What kind of healthcare support? Well, in the first place, in an adjacent vicinity, like the maximum 1 hour by foot or 15 minutes by public transport, every individual should have a full set of prevention measures, like regular screenings, like the outpatient checkups, correction of the factor risks, specific prevention practices like inoculation, immunization, and an outpatient monitoring of people with chronic diseases like the secondary prevention. So this whole prevention factor makes a contribution into preserving the health for at least 60%. At the same time, the cost of this as a pro rata from the total cost for the provision of healthcare aid accounts only for 12%, while 4% is the medical prevention and 8% creating conditions for a healthy way of life. At the same time, within a walking distance, that should be a primary care aid for the most prevalent and not threatening kind of diseases, and every person must have an opportunity to be hospitalized within 1 hour into specialty centers of emergency aid, which have this nature of intermunicipal treatment, like injury centers, cardiovascular ones, and in the need for a scheduled help, a specialty high-tech aid within the next 30 to 40 days to find a place for treatment in a specialty or in some difficult, complex cases, resisting cases in the federal medical centers. Essentially, there is nothing else apart from this, and every person who lives in this jurisdiction must enjoy this opportunity, and in such a way, every region, relying upon our unified electronic geo-information system, which demonstrates the location of all of the townships and municipalities, the full transportation infrastructure, which in an automated way enables one to count the time that will take for an individual to be delivered to any institution, to establish an automated system. And so this particular goal, how to develop a proper infrastructure to achieve this outcome, in many ways creates the conditions so that various timings to maintain this particular work within a set period to be adhered to. At the same time, in terms of the remote locations, one needs to develop the mobile teams of medical experts equipped with portable or mobile equipment. Yes, thank you. Could you please pour me some? So all of this represents different components of the national projects. Now, the regions should provide for transportation infrastructure. And this is not the proper state of the road network, but also, whenever necessary, public transportation, very convenient delivery to medical and healthcare institutions, which are some distance away from the municipalities, which in many ways defines the efficiency of the land-based ambulance work. And apart from that, the regions should have very precise calculations in terms of what kind of response in emergency aid should be maintained. At the same time, the availability of a sufficient number of highly skilled experts and certainly quality of medical health care, which means introduction of modern technologies in diagnostic and treatment on the basis of the already developed and introduced protocols for healthcare, like routing, logistics, the staging and various milestones, and timeliness of everything that is supposed to happen, clinical guidelines, protocols, and criteria for the quality assessment of medical aid. Apart from it, an important condition is to create a single digital framework, digital technologies, which in a substantial way should improve the quality of managing all of the resources and would make it possible to introduce electronic documentation, expand the telemedicine opportunities, and so on and so forth. And in view of the fact that every region adopts very individual decisions in terms of how an infrastructure should be established to resolve local problems, where outpatient work should be done, in what way transportation infrastructure should be developed, in what way additional recruitment of the healthcare professionals should be performed, there is a single methodology and the norms and rules in place, and as well in the case of healthcare, the single funding source, which is very important because 90% of healthcare help is being provided from the Mandatory Medical Insurance Fund, which since 2013 works on the basis of per capita, based on the well-known subventional rules. And so the single program of the government guarantees for the free medical aid, the single mandatory medical insurance database, and the single tariff policy, which as of this year works on the basis of the two keys, the single methodologies of estimating the needs for healthcare professionals, the single set of requirements towards the electronic healthcare system, both at the level of organizations and the regions, and undoubtedly the single notional kind of documentations, which are living documents, continuously updated, which effectively contain within themselves a certain national status. So these single set of requirements against an absolute freedom for every region so as to be able to adjust these requirements towards local peculiarities constitute the main principle of developing the national healthcare system. One of the most important national objectives for the whole country is to achieve the average lifespan in excess of 80 years by 2030. How one can achieve it? Only by one way, by reducing preventable mortality. And in order for us to be able to achieve this lifespan of 80 years by 2030, already by 2024, we need to save additional 230,000 lives. When considering all of the available resources, we may say that the biggest resource can be found in fighting cardiovascular diseases. 88%, 203 out of 230,000 lives is what we can save simply by resolving the problems of the cardiovascular diseases. 24,000 improving the oncological systems, 3,000 these are the system of improving the childhood infrastructure, and at least 50% of the contribution, respectively, into all of our general indicators of life-saving methodologies comes from the primary aid. Undoubtedly, these very important projects cannot happen without a successful enabling projects, which is introducing throughout the whole territories the documentations which provides for the good quality of the medical aid, clinical guidelines, and the treatment protocols, for which purpose we're developing a network of the national medical research centers, which have been set up just not long ago. in 2016. They have been recruited from the best leading federal medical centers. These are core methodologies, the flagships within every medical treatment area, which currently, with all of the specific regional institutions, work on introducing the medical healthcare quality management systems. These are highly skilled people. And so the solution of the problem of a shortage of it through the purpose-specific recruitment and training means a good quality of training, certification, continuous medical education, computerized trainings and other methodologies, and certainly that is developing a single digital framework, because we ought, by the end of 2021, to combine all of the digital frameworks within the medical healthcare institutions, within the regional segments, together with the centralized basic healthcare services. Today we have mentioned it, like the central dispatch offices, which manage the land-based and airborne emergency aid, centralized archives of the laboratory tests, and a whole mass of other capabilities. But towards the end of 2021, these regional segments should be so much in compliance with the single standard requirements, so that together with the single government information system, they should integrate together so as to circle the single healthcare national framework. So all of this put together has defined the effective structure of the national projects. So 4 national federal projects as well as the 4 enabling one. So what is important to underscore, that all of these projects are not simply interrelated. They are the throughput kind of processes which defines the efficiency of each other. For example, fighting cardiovascular disease. In order to reduce the mortality from cardiovascular diseases, we need to provide for the good quality prevention in the primary care, a good outpatient monitoring with the drug support at the primary care level. We need to introduce clinical guidelines which are contemporary approaches, and we need to provide for the system of professional training, setting up a specialty profile digital framework for the cardiovascular diseases. At the same time, I would like to note that just one measure prescribed within this particular project is being funded: re-equipment of cardiovascular centers, while the rest of it means a set of logistical, HR and other undertakings. So in this regard, what makes this particular project different from some others? Whereas every region would like to, spend the money and change the old tomograph for the new one, you would never reach any kind of result. This is just a mere kind of condition that is required by funding prerequisites, while others are not requiring it. And that is exactly why the first quarter will be related to developing regional programs within which all of these components logistically prescribed will be further identified, and every region will have its roadmap of working on this program. Only in such a case we will be able to realistically change things for the better. Right now, all of the 85 regions, generally speaking, are ready to start working on the national healthcare projects. We are ready to go, and I would like to note that over the past few years, very positive, good changes have been planned in many areas of healthcare, in many regions. Today, we have governors in attendance, the ones who boast very substantial breakthrough results in their respective regions, and we would very much like to hear this pioneering experience of our regions. And I would like to ask Natalia Vladimirovna to touch upon the most complex topic with respect to a northern region, northern territory, to develop the primary health care and health service. So how do you go about it? Thank you very much, Veronika Igorevna. Dear ladies and gentlemen, good afternoon. Yes, I also have paid attention to the slide which described the importance of the primary care, and 50% in the whole system, providing for the efficiency of what is being done there. And indeed, our region, in a very natural way, is characterized by various problems which pose obstacles for the health institution to perform their work, which is enormous territory, 540,000 square kilometers, very remote, hard to access locations, compact density of various indigenous people, which is a separate story. And so because of that, healthcare people work on land, in air, on water, and through internet as well. In our time, like the case was with every region and basically the whole country, thought to ourselves about how one could improve the efficiency of the work done by the healthcare system. And the first thing that always comes to mind is to try and reduce and through limited amount of resources to do more and more. And we had to acknowledge that at the current time to organize local outpatient centers for 120,000, and altogether there is 1 million, almost 700,000 people residing in our region. So in as far as 120,000 people are concerned, we don't have any other opportunities apart from the ones that I mentioned, and would mention additionally some of them. So alongside with having upgraded the existing outpatient centers and local clinics, we have also trained in as far as some townships are concerned. We had trained a certain number of people who can and are authorized to administer primary care aid or report on a certain medical problem to respective government structures. Then the medical aviation does about 5,000 airborne hours a year. So what have we achieved by setting up such a network and starting to operate it? Within 2 hours, in as far as any location in the region is concerned, one can in as far as an individual requiring such emergency aid is concerned, you can get over to him, and if there's a need to deliver such an individual to a specialty care center, and I can tell you that 2018 we finished with such a result in 90% of cases. So there are things to be improved, but nevertheless, at the same time, this is a quite good result. We also have a floating, drifting patient clinic, and this year we have provided medical care using equipment and expert help that we have in various inpatient hospitals. All of such solutions are on that vessel, and so 10,000 people in 83 remote locations, people were able to receive such help. Now, speaking about the electronic support system, I would like to draw attention to the project that we have to provide support to healthcare professionals in diagnosing various diseases. And during the past year, over 50,000 searches were initiated and almost 150,000 requests initiated to various databases, which helped to choose, as we hope, effective treatment. And we are very happy to say that we could have been possibly the first ones in the whole country, and we have started certain cooperation with other regional countries in as far as the telemedicine is concerned. For that purpose, every workplace for the healthcare professionals involved is equipped accordingly, and so these people can actively participate in this project. I also wanted to note that despite the fact that, for example, if anybody attended the previous meeting, our region produces oil and we do have money, but we still do need this money. And so, because of that, we're not always having enough resources, for example, to provide a sufficient number of healthcare institutions for all of the people residing in the regions. And so we were able to find a certain substitution in terms of where we build hospitals, fully detached ones, and so we buy out various spaces in the multi-story residential buildings, placing clinical areas there, both for children and adults. 30,000 people are provided with such opportunities based on the results that we assessed as of January 1st, 2019. And simply because people do use this and people are interested in having a clinical institution and the place where they call upon their GP to come closer to them, we believe that this is a very good solution. We at least are very well satisfied because within the same period of time, we wouldn't have been in a position to provide the same number of, a respective number of clinics to cover all of the people. But since this is a discussion, let me also talk about a few challenges as we see them. They may not be quite conventional. You may wish to criticize me, but nevertheless, let me try and say a few words. So the first thing, in terms of the life longevity and increasing the span of life, this is quite a large-scale objective, and it does, as you put it, Veronika, requires a throughput effort. And I believe that it is very important to be able to apply all of the resources that we have in the most efficient way. For example, 85 regions, and every region has its own specialties and peculiarities. But there is such an institution as the order of providing medical help. And like I was recently told by my regional expert, there are 58 of them which cover all of the specialties that we think we do cover with a certain safety standards in relation between a doctor and a patient. And as the experts say, the most digitalized ones is about the order of providing medical aid to acute brain blood circulation. The effect from such an approach, I believe, is a colossal one, because if we are to consider the insult to brain mortality, so since this order has been introduced, the reduction was almost by 25%. Heart attack mortality, 17% reduction. So it's the fact, so you cannot argue with that. And so effectively, what it boils down to, that the minute-by-minute protocols, they are, in this area, are the kind of lean technologies. And the reason I'm saying it, I don't know what you might respond to it with, but I do believe that this kind of a standard, and I do support the Minister of Healthcare in terms of the lean systems within the clinic. This is something that the outpatient hospitals and centers should also start adhering to. But the second thing that I would like to point your attention to is that these protocols and orders that I've mentioned, and locally they're currently being somewhat amended, but the 7-year cycle has gone into the past, and so certain things have to be changed. The healthcare community is well trained and ready to work in the area of digital competences, and so that is why it seems to me that this is quite important, and there is a demand for that, I feel. So the second point, there is such an objective for Russia to join the countries which effectively export healthcare services. And I took some statistics. There is a ranking, including 41 countries, where Russia is on the 34th place. And there is a data coming from the World Travel Organization under UN, which assesses the potential of our countries in a very high way and gives us the 5th place. While the possibilities to utilize this potential, we have the 59th place. And in my mind, in this sense, I mean, there's a lot of work to be done in respect to this particular challenge, and there's a big risk in us trying to notably move ourselves up along this ranking, because no, we're not going to be talking again about any throughput solutions and any special attention to training people in foreign languages, in marketing services, because it's a totally new area of activity which definitely has to be developed, like developing the infrastructure and services market, because not only doctor and equipment are important and the acumen that is applied to this, but where do we come? Because Taiga is a good place, but it has to be made civilized in order for people to wish to come there to receive treatment. And the reason I mentioned it, because for many years we have been working at these fora together with the BRICS countries and the Shanghai cooperation organization with my neighbor, the governor from the Tomsk region. We're running. So let me, Veronika Igorevna, try and suggest that we should, under the auspices of Minister of Healthcare, hold an expert session dedicated to the development of the healthcare tourism, and specifically utilizing the opportunities in the digital economy to develop the export of healthcare services involving the regions which would be willing to participate. So the third point is the demand for the high-tech technologies, research done for the birthright development. It's a very special topic, childhood health, family health. We do a lot of things, and actually this year, in our region, on top of the Russian initiative, have been announced as the year of the family. So please come join us and to create families, to give birth to children. Why? I mean, I simply would like to take the opportunity and aiming for a certain future development of this kind of work. And Mr. Minister paid attention to this 15% of the, the 85% which comes from the environmental effects in making contribution to human health. But these 15% has to be made to work, and whatever is related to genetics is currently very, very vital. And so, in this regard, I'm very grateful to you, Veronika Igorevna, for the decisions you are making, and specifically to locate the R&D laboratories and sites in our region to specifically research the issues related to studying the genome of our people, including the Arctic and subarctic territories, because there are very specific things, so that you should understand this is not just playing any games, but this is very much the core of what we are described by. This is where the people of Khanty and the people of Mansi, the indigenous people, live, only in our territory. So it is very important to understand what specifically these citizens, these people require, and to ensure that the Arctic North and the territories which are equal to the Arctic North, those who live there, because it was mentioned that we sometimes spend money in order to allow people to travel away from the North Territories as soon as they're ready. I would suppose that we should additionally pay to those who will choose their place of residence to be in the Arctic North or the Northern Territories, and we should make everything possible in order for the conditions to be better, because this country, having colossal and vast territories, truly needs for every square kilometer to have a well provided for person enjoying a safe and healthy life. So welcome to the Khanty-Mansi district. Thank you very much, Natalia Vladimirovna. Thank you for touching upon the topic of innovation and development. Certainly healthcare is the kind of area which not only continuously develops, because the whole knowledge of the global health doubles within every 5 years. and that is why we talk about the order of providing medical aid. There are about 68 orders. Just 30 of them have been upgraded during last year, and they're being upgraded as need be. Not all of them are equally digitalized because there is certain pathologies where every minute counts, and we're talking about the specific timing of the delivery, from door to the needle, first manipulation, first intervention, and so on and so forth. There is a scheduled kind of aid, and so a different economy plays out itself there. And we definitely support your proposal about the special form and the possibility of exporting medical services. Actually, dear colleagues, we have already raised the bar. If you may recall, we reported to you on the result back in 2016, 20,000 foreign patients. In 2017, it was 120,000. In 2018, based on preliminary estimates, over 300,000. And that is why this curve is growing upwards. These tasks have been set. They're very serious, and we find them very important because that means additional resource being brought into our system. And definitely together with you, Natalia Vladimirovna, we will simply additionally discuss this, and we will prepare ourselves. Sergei Alexandrovich, what about him? All right. Yeah, he represents a wonderful region, scientific region, the region of Tomsk, the region which already has the total mortality of just 11%. This is the region which, in a very considerable way, by 16%, is characterized by much lower CVS mortality rate. Sergei Anatolovich, could you please tell us how do you cope with these basic problems and reasons behind mortality rates? Good evening, Veronika. Dear colleagues, it's really great that as part of the economic, let me remind you all of it, economic forum, we are talking about the most important industries such as healthcare. Veronika, maybe we should continue, and maybe as part of a certain medical forum, we should talk about the Russian economy, because it's really great, because healthcare is one of the very important issues in any individual's life, and you can argue what's comes first, the economy or human healthcare. And this is indeed a very good topic. 85 projections of the national project, and this is true that we are all 85 regions. We're all different. It's like recalling on the Leo Tolstoy's writings. All people are happy in the same way, and they're unhappy in each individual way. We know that there's 85 projects, and Vladimir Putin, president, published a decree whereby there is a working group which has been set up, made up of the governors, headed by Sergei Sobyanin, who is the mayor of Moscow. And within this big group, I'm in charge of the subgroup on healthcare and demography. And together with the Minister of Healthcare, together with Veronika Skvortsova, over many months we have churned out a lot of work. And I would like to really say that a great job was done. We, the regionals, basically never had any discrepancies with the ministry, but as a result, indeed, a very surprising thing happens. You see, there are a lot of common problems, but at the same time, primarily, the issues that we face are very individual. Over 100 proposals that the regional representatives gave us, we have worked on more than 100 of them, and so when towards the end of the year we met with Vladimir Putin and I reported on the results because we were trying to assess various risks that one can see in demography and healthcare. We were coming up with various ideas, and I specifically told Mr. Putin that this particular specialty has to take into account. I'm not going to run the full list as an example. For example, we never think about the national projects which have in them building new social infrastructure, and that applies not only to the healthcare, hospitals, the schools, the rest of it as well, because you live in big urban centers, in regional centers, but it's interesting because somewhere in the regions you don't need to build any new facility. You simply need to upgrade the old ones, the old hospitals, the old schools. It's quite logical because there's no longer space enough inside the city, and so on and so forth. So we come up with so many ideas that already have been transformed into the governmental tasks, and I'm sure that this particular evolution will continue. But Veronika Igorevna asked me through the example of our specific region to say a few words, and I specifically would like to say that one should take into account this peculiarity because back in the Soviet days, when everything should have been in the same way in every territory, it's still there. Yes, everybody should have a free economic zone. Everybody should have something free, something that. It's not right, because every region is developed in its own way. Just look, what makes us different? I mean, the Tomsk region, apart from the fact that We are one of the scientific centers in Russia, apart from the fact that for 250 years we were just the only territory behind the Urals, from the Urals to the Pacific. Always, giving this example, there was no mobile phones, no fiber optics, and there was only one governor, doing the whole work currently over the territory where currently you find 36 governors. But this is a different story. So what are the difficulties we're facing? Our difficulties, territorial. The territory is bigger than the United Kingdom, the Tomsk, or bigger than Italy, or if somebody like more than 4 Poland. And that does impose certain specificities. And what kind of specificities are? Transportation. This is the infrastructure development. This is accessibility for healthcare aid. And that was why several years ago we have brought in our smart people trying to use our scientific potential. Together with the Minister of Healthcare, we have come up with various CVS diseases, which is in the first place, not only in our territory, but throughout the whole Russia. So what did we do? We created a situational center which works 24/7. And something that Natalia Dmitry mentioned, yes, indeed, and that is also about the telemedicine, because we have put in there the healthcare aviation, healthcare professionals. Specifically, I would like to say a few words about the healthcare aviation, thanks to Minister of Healthcare, because this whole initiative is developing. There are special helicopters that have appeared which provide for such an aid. This is a great thing. For example, it was somewhere 130 million rubles that, together with the Federal Minister of Healthcare, allocated in 2017. In 2018, it was already 230, and so we're doubling this amount every year. This is great against the problems that we're having in a big territory like ours. And this system really performs quite well. Now, the second thing we did, we created a single information center in our online internet, because quite clearly we have connected our software development. And so every disease in the territory of the Tomsk region, you name it, it is being processed, digitalized, and is uploaded back into the situational center in order for various measures to be undertaken for analytical work. And the third thing, we are quite unique in the sense because we've got 6 federal institutions within healthcare, which is the Academy of Sciences, which have been merged into a single center. And we definitely, if you take like CVS diseases, we use the Cardiology Research Center and the Minister of Healthcare doing various special programs. We have the oldest university in Russia, in the Tomsk University. So what has it produced as a result? It has not mentioned, but I would like to underscore it again. For 5th year in a row, we register the reduction of the mortality. For 5th year in a row, mortality goes down from the CVS reasons. This is great. We'd like to remind everybody, myself now speaking in my capacity as the head of the subgroup, because the task is to achieve 372 cases per 100,000. Today is 492, so you have to do some work. First, you have to do whatever is written in the national program. Veronika really told us a good story about it, and that is where you find the proper means in this program. The second, like I mentioned, to take into account the specificities of such territories. Whenever you need to build a new hospital, you should build it. If you don't need it, then you should just spend money on something else that the territory requires. And thirdly, to share out the experience which I am really giving away, almost, and I hope that maybe I will get an extra medical helicopter, right? So thank you very much. You see, already I was able to get some preferences for the Tomsk region, not for free anymore, right? Yes, so it's a very realistic program, and from the point of view of the regional representatives, that group has been specifically set up in order for us not to control, but together with the government to identify risks and to move forward. So for the first time in Russia, such programs, as far as I know, there have never been like that programs before. I'm not certainly a professional. The professionals should be saying something about it, but in any case, I do like this program, and it is something that really generates results. Thank you. Thank you very much, first of all, for such a great job. Thank you, Sergei Anatolievich. And now I would like to move over to the Samara region. Samara region last year had 0 maternity mortality based on the results of the 10 months. This year has very low childbirth mortality, 4.1 per 1,000 newborn, and so mortality of the children before 5, the lowest one 5.8 per 1,000 born. So the whole country achieves such reduction. One of the leaders in this is the region of Samara. Dmitry Igorovich, I would like to ask you the development of the childhood healthcare, the system of childhood and maternity. How have you been able to achieve such results? Thank you very much, esteemed Veronika Igorevna. Good evening. You know, when I was listening to Veronika Igorevna, I'm already feeling much better. You know, acquiring a certain comfort in my soul, and because over the last year we regularly communicated, I've entered into the period of transformation. Veronika Igoreva specifically mentioned that the destructive behavior, bad habits, stresses. Veronika Igorevna, one bad habit is something that I was able to part with, because I understand that through your personal example, a healthy way of life, people should demonstrate. Now, destructive behavior, I'm quite able to cope with. You know, governors basically don't have any stresses at all, as you can understand. But on a serious note, certainly, Veronika Igorevna, I would like to say a few words about the national project at the regional level, because once again, I would like to sincerely thank you that just during the stage of its preparation, you personally participated effectively in fine-tuning the regional component of it. You participated in the strategic session, the saving of the people, and you gave us a lot of good ideas. And most importantly, dear colleagues, is that in the beginning we had to understand where we were before, planning any management decisions. You have to analyze the current status of things, and we did it. And I would like to tell you that Veronika Igorevna told us about the newborn mortality, but as far as the CVS mortality is concerned, we had quite a favorable situation. But when we started to seriously analyze and to get to grips with the coding of the reasons of mortality, we realized that the statistics were not very much authentic, so to say. And in order to be able to plan for any management decisions, we had to undertake a very serious analysis. We became aware that our situation was not so favorable, it's not so good, that unfortunately our statistics are much higher and the dynamics are not so good. So if we were not to do this, we would have ended up with the wrong management decisions. We would have gone for the Minister of Healthcare to ask for the wrong, help. And we would have wasted the money, because it's the principal importance. You can put on your rose glasses and see everything in a fine colors, but you would definitely make mistakes when making management decisions and when spending, taxpayers' money. And we definitely put together a very good social mapping, whereby we commissioned it not simply just to understand the level of satisfaction with the healthcare aid. We segmented it: emergency aid, inpatient hub, outpatient work, GPs, and we realized that the main problem, the biggest dissatisfaction amongst the people, was with the expert doctors in the primary care. What is it? Whether the people who work there are not professionals? No! Excellent people. The Samara Healthcare has been able to confirm its higher level during the Mundial. There were some complex cases, and our local doctors were able to provide for the global standard quality of help. Certainly, the problems are within the management system and the governance systems, and that is where we focus our efforts when developing the regional and national project. Well, clearly, this is something, in the first place, not enough people. People have to line up, people are upset, and that the level of professional training at the primary level is not so good. Also, based in terms of the general practitioners, we're better off. In terms of the emergency medical aid, we're also better off, although a lot can be improved. Vladimir came to us and he saw that in the, for example, Khanty-Mansi region, all of the emergency aid vehicles, they do comply with the standards, but we were able to start improving things only in 2018. So, dear colleagues, the root cause analysis, I can tell you that we won't be able to do well if we don't engage people, and that was why I started with myself, and we will do our best in order to bring people into this initiative, because the healthy way of life, and Veronika Igorevna started talking about it, is something that defines the span of life, the quality of life. Without people, no government, no ministry would be able to work. And so we simply have to explain that this is something that everybody should get involved in. Now, and as far as the national project is concerned, just in a nutshell, indeed, here we're changing, the primary care in the rural area, 25 outpatient clinic, 13 mobile units, which will enable us to provide for emergency aid and primary care aid in all of the corners of our region, fighting against the CVS diseases. This is #1 priority. We have reconsidered our approaches. We received respective professional assistance from the Ministry of Healthcare. We plan to open additional 2 regional CVS centers. We'll have 6 altogether to upgrade the existing ones and to move 2 of them into the southern areas of the regions where the timing for the delivery is not currently being met. And also, a lot of attention is being paid to the oncological diseases, and as part of the national project, we're re-equipping 2 oncological outpatient clinics, helping up who will open 12 additional centers, and that is something that I would like to thank our colleague from the Ministry of Healthcare. Child healthcare, we have some good results. The childbirth mortality in the course of 20 years is the lowest one in Russia, and we gradually lower it further down. And these are very real statistics. By 2024, we should achieve the statistics of the 4 cases per 1,000 newborn. And we've got all of the necessary conditions for that, particularly taking into account what the projects provide us with as of 2018. And you can see on the slides various measures are being performed to re-equip child outpatient clinic. 110 new units of equipment have been procured, 34 installations, and in 2019 we would make an emphasis upon the heavy kind of equipment like MRI equipment and radiology equipment, which would make it possible to move diagnostic practices closer to where children are. Alongside with that, with the help of the regional budget and the mandatory medical insurance funds in all of the 52 child hospitals, will introduce the lean system for their operations, like Natalia Dmitry mentioned. Unfortunately, we went about this very important process a bit late last year only. Well, and now with all of these measures put together, including in the area of the child oncology, because we have certain statistics here, you can see them on the slide. Just to save time, I'm not going to read them, but our key performance indicators, something that we do plan starting from 2024 annually, would be able to save more than 4,500 lives. Just imagine what kind of figure it is every year. So this is the side of national projects and the systemic work we do in the area of child healthcare and the newborn mortality and birth help helps us to achieve such result. But if there's a need to learn more about what Samara region has, please come to us. And on our side, we would be more than happy to learn the kind of experience that we may derive from the Khanty-Mansi district and from Tomsk. We have already traveled to the Kirov region, and many of the good things that the region has been able to establish there is what we use. And so I would like to thank our colleagues very much for that. Veronika Igorevna. Dmitry set a new trend. Start from yourself. And I would like to say that, once I became part of the group, I quit smoking for 6 months. I haven't smoked before that for 30 years. And the next thing, I'm telling all of the Tomsk people, do the way I do it. So we are exchanging experience. Yes, it's, you get the kind of people the way you are and the way your president is. So I would like to thank Dmitry Igorovich. I wish you all success because you are following the right path. The whole region, we do feel it. So, God willing, everything will carry on as it does now. Igor Vladimirovich. The Kirov region is one of the leaders in developing digital healthcare in Russia. It is amongst the 12 most advanced regions, And your region was exactly the one we first time came to in order to demonstrate the lean system in the clinical environment. And that lean hospital was being done based upon introducing digital information system in organizing all of the process in it. If you could possibly share your experience, what have you been able to achieve by now? Thank you very much, Veronika. Dear colleagues, I would like to speak very briefly, understanding that it's not a very easy thing to do after all have spoken and late at evening, but at the same time, I should begin with myself. I have quit smoking 11 years ago. My level of stress, somehow went down to 11. I guess that Veronika Igorevna does produce this very calming effect. Now, and as far as digital economy, my first education was a software programmer and mathematician, so it was very easy for me to find a common language with the colleagues. It is absolutely fair to say that our first lean hospital, I believe that is the highest bar that we wanted to achieve, we started demonstrating it to the president. So from then on, we couldn't step away from such high quality standards, and I will try and very briefly tell you about digitalization and the basic materials. They are going to be watched on the slide. We decided that the key objectives to us is to improve the accessibility to medical aid to the patients, while the healthcare systems should be given additional instruments as well as control over the demographics, amongst other things. And so, as the practice have shown, the most sought for solution was digitalization in the hospital system based on the lean principles. Information technologies help us to resolve one of the most vital problems, which is signing up for a visit to a doctor. Patients, even being at home, can independently sign up in an electronic registry into any outpatient clinic, and in case there is an indication, to choose a narrow expert at a convenient time, or at least to see where it is possible, for which nearest date it is possible to sign up to see a doctor. In an outpatient system, we have electronic line management, which automatically, sort out waiting time being reduced. It is possible to refer patients through the registration desk or bypassing it. So it all improves the accessibility and, most importantly, reduce the social tension. So all of such principles have been implemented in the Lean Hospital project. But it is necessary to mention that in the whole territory, all of the medical records, including hospitalization reference, laboratory tests, equipment tests, are maintained within a single information data system, exceptionally in the electronic form. And that system also has all of the test results being registered in it. Information about the released patients, the dismissed patients, is being also reflected in the single territorial database. We have our own cloud. And so this is the data that all of the performing doctors can use. Let me just quote an example. We started this work just recently, but as of right now, we have more than 3.5 million documents in this database, covering 1 million patients, and we actively applied telemedicine technologies. Starting from 2017, all of the emergency aid teams, part of the offices, which is a GP, are equipped with the equipment of automatic deciphering and the delivery of the ECG data. Now, this information is being delivered to the cardiologists on duty in the regional cardiology center, and today we have almost 88,000 ECG records, and the doctors will understand this is a very real record. On January 10th, a patient from a remote region was interpreted and hospitalized. In 2019, we are planning to have the system cover all of the GP offices throughout the whole region. And an important point is that as of 2018, patients after the heart surgery in our regions have remote monitoring systems installed, because these devices do record their vital statistics and transmit into the regional center as well as into their treating GP. And this device has an SOS button that the patient can press if he feels a certain worsening, and the system is capable of responding to it in the shortest time possible. And the ultimate purpose is to change the demographic situation, because the GPs, the primary aid doctors, do have the opportunity to analyze mortality in terms of the gender and age structure and every therapeutical area to make a very specific decision. And so we made up our mind. As of July of 2018, we introduced additional payment to GPs, family doctors, for reducing the overall mortality in the area that they're responsible for, oncological mortality and CVS disease mortality. So these measures enable us to reduce the mortality dynamics in 2018 by 4%. Information technologies also help in various financial aspects of what the healthcare institutions do. All of the pharmaceutical drugs and devices are being prescribed through electronic list by the treating doctors and being directed by the electronic system per a specific patient. And that helps to create a system of scheduling and planning, and makes it possible to provide for every person requiring such a help on a very precise and timely basis. For example, I can tell you that such activities help us to save up to 20% of the purpose-specific funds. In an outpatient conditions, information system contains the full account of the pharmaceutical products for the reimbursables categories. The reimbursable recipes are being printed and registered, and all the government pharmacies are a part of it. And I can tell you that such technologies, as well as an existence of a government pharmacy network, helped us to introduce in the Kyiv territory the reimbursement at the first time, the first stage, to the people with various cardiovascular problems. The Kyiv region, maybe not the first one, but at least one of the first, which made it possible to download the billing information from the electronic system, because professionals understand how much it simplifies the whole process. Currently, in our system, we work at full automatic tariffing as part of the overall billing process for healthcare, taking into account the interterritorial settlements. And this kind of a tariff agreement enables non-specialty healthcare institutions in the Kyiv territory to compete for the patients. When selecting by patients a better non-specialty healthcare institution receiving aid, be it in a local clinic or in an inpatient institution, money through the mandatory healthcare insurance is being allocated to the kind of institutions who provided such care. As of 2019, we expect tariffing for settlement between the institutions who work within the mandatory medical insurance, and the patients get the opportunity to choose for where they're going to do their MRIs and other tests. In this way, the medical institutions now gain the motivation to improve the conditions of care, and not only that, but to additionally earn money, while the patients get the opportunity to choose the best healthcare institution in their mind. And most important thing is the convenience of being able to sign up for a call. So accumulating this whole mass of data within our information system would enable us to start working on creating the artificial intellect, the system for the support of medical decisions. Colleagues mentioned it because there's no other way about it. So I would invite everybody to come and share your experience, because I'm sure that you may find great ideas in every region. It is very important to be able to note them, and through the ministry try and optimize, and what my colleague said, to come up with a proper management decision, so as not to spread thin all of the funding, not to reinvent wheels in every region, not to trap upon the same wires, but use whatever has already been proven as effective. And so, as far as the artificial intelligence is concerned, that is going to be the early prevention, early diagnosis of the risk factor, and the second thing, an ability to assess the efficacy of the treatment methodologies. So, briefly, I tried to tell you about our modest results. I hope that we'll be able to move on together with other regional colleagues. So let me just say a couple of words about the export of healthcare services. Yes, we're also in a position to make a little contribution. We're already making it. So we are very active in inter-regional all kind of work like the medical tourism. You know, we came up with this particular wording, I think about 12,000 patients. When I saw the advertising, the Kirov regional clinic was being promoted through the central TV channels. Well, it was not accidental that at the Economic Forum we are discussing it because we are always talking about multipliers, but somehow we are only mentioning them as applied to the construction industry. I would say that it has the biggest multiplier because this is in transportation that we ought to offer. People need to stay somewhere, to live somewhere, to eat somewhere, to entertain them. And so this kind of medical tourism is the great engine, the great driver, for the regional economy. So this is it with me. Thank you very much. Thank you very much. Dear Igor Vladimirovich, effectively, your region is indeed almost a role model for the country, because you know that I am sending representatives from other regions to go to you so that they could see with their own eyes how it all works in the Kirov region. And of course, to us, digitalization is one of the most important priorities. And this is the only federal project where 70% of resources for 6 years have been concentrated within the first 3. This project is necessary for us to be able to effectively work on the rest of them, including oncological, first of all, which requires an establishment of a separate vertically integrated framework. So we are very grateful to you, and we shall continue a very close cooperation, because right now at the ministry we have a separate structure being set up. This is the structure which will be the competency center, and effectively its job will be to fine-tune the regional system up to the state, which can be integrated with other systems into the single framework. Dear colleagues, we also have in this room the heads of the national medical research centers, our senior experts, and I would like to ask a question. What do you believe you can help with to implement national projects with such different 85 projections? And I would like to give the floor to academician Shlachto Yevgeny Vladimirovich, who is the general director of the Almazov Center in Medical Research Center in St. Petersburg. Esteemed Veronika Igorevna, dear speakers, dear colleagues, Veronika Igorevna, I even do not know what I shall begin with, because we've got the regions represented here, which are the leaders, each one in their own right. We heard and saw today how these regions are able to make the best of what they have, coping with the difficulties, develop programs which help them to overcome these difficulties. So it is quite clear that 85% healthcare models means 85 regions, and these are different geographic settings, these are different opportunities in terms of science, the higher educational institutions being offered different level of data penetration, different economic conditions quite clearly. It all affects the kind of modeling that the regions are going to pursue. But it seems to me that the strong side is that we have the federal part of the national project, which is quite understandable. We know where we should go, and like everybody noted before, the wrong decision-making as a risk has been mitigated down to the minimum. And so what is it that I would like to draw attention to, really? Veronika Igorevna, invariably, as the result of the kind of measures that we have heard about today, situation is going to change at a very fast pace, because we have already, in many regions, have reached the ceiling in terms of the mortality reduction from the acute coronary syndrome. In a number of regions, we can see that the number of patients goes down. Yes, it does. By 5% a year, tomorrow it's going to be 10%, so it is quite obvious. In Tomsk, I'm sure that the number of patients like that is not growing, because the statistics that have been quoted, they sound fantastic to me, but we've got all of our friends working there, and so we understand why, because it's a unique city. Now, I guess the third population in terms of the number of students in it, and so the situation is going to be leaning towards chronic diseases, like you said. regenerative diseases, comorbidities, and diabetes mellitus, and obesity. And so this is something that within the programs that are going to be planned is what you have to take into account. These kinds of risks, which are going to change in terms of their overall picture. And the programs have to be aiming at that. And monitoring is necessary. And so I'm very happy that at the level of the Ministry of Health, we're going to have such a national project. And so thank you very much, Veronika, in the national centers. We openly work with the regions. We have very close relations with them. I'm not talking about specific calls and visits, but on a standing manner, talk to each other, through televised links, and we understand what is going on in the region. So what I think is that the kind of possibilities that the national centers, that the Institute of the senior and the leading professional experts, non-executive experts, and the professional community, and sorry for me to say that, clinical guidelines, various protocols and orders for the provision of healthcare, improving the ultimate quality of it, is something that would help us in achieving our objectives. And the last thing that seems to me important to mention, I suppose that, of course, the level of information, digitalization. It's not that it is critical, but it is very important for us to be able, during these first stages, to connect this whole integrated approach in providing healthcare, from prevention to rehabilitation after aid is done. It all has to be brought into this digital framework. Once it is there, we will have the analytics, we will have the data, we will have the predictive, prescriptive analytics, and that would enable us to make proper decisions. And I do say that in as far as the digital, and generally speaking, in as far as the system of monitoring situations in every region is concerned, with various elements of benchmarking exercise, is something that I do say would be very useful to all of us and to the regions themselves in the first place. Thank you very much. Thank you, Evgeny Vladimirovich. Today, Gleb Sergeyevich Nikitin, the governor of the Nizhny Novgorod region, has called us and said that he fell sick. He was supposed to tell us about fighting oncological diseases, but we have the general director of the Radiology Scientific Center, academician Kapling, our lead expert in oncology. Dmitry, could you please say a few words? Well, first of all, I would like to thank Veronika for such a presentation, which makes my job of speaking much easier. And I would like to also thank for very straightforward presentation that the governor has shared. This is an invaluable experience. We believe this is a whole school to us. But I would like to begin actually by quoting Erich Remarque, who said that when we all fall in our spirits, and he remembers me, come to me, to my hospital, so you just make one tour through the oncology division, would forever relieve you of any stress and the feeling of desolation. Yes, of course, we still face a lot of objectives. One of them is related to the level of disease. It is going to grow, we understand it. Based on the Chris White, this is the heart of Meyer, 24 million will be the number of patients which every year develops oncological disease instead of 16.1. Now, what is the reason behind it? Of course, because of the aging and because of the greater number of people. And we set ourselves an ambitious task, 18 more, geometrically. That will be the number of oncological patients that would grow, because one of the most important indicators to us should be not only the one-year lethal outcome, that is something that we are coping quite well, that is the first and the second stage, that currently we've got 56.3%, and in an ambitious way we've got 63 and more, and up to 70%. But we need to understand that this is what will increase the number of monitored patients with the cohort that is going to be continuously monitored. Because currently we monitor 566,000 people that we identify every year, so 3,650,000 are being monitored. It means that we will need to expand at least by 1.5 million the ones which are monitored. And so that, in terms of the capacity of the oncological services, that is something that you have to train your people for. Because whenever we talk about a growth growing number of the monitored, we do understand that this cannot be the burden for the number of healthcare professionals currently involved in it. So what we can help with, of course, it is great that based on the plans of the Ministry of Healthcare and based on the data that it shares, there will be just enough to do hospitalization once a year, which will be a compulsory thing by 2024. It is important? Yes, it is important. One patient, it means, should once in 2 years' time go through the screening based on the 3 programs that are common elsewhere in the world. There's colorectal and the mammal and the cervical cancer, the most common ones, and so this screening is well justified, and we are ready to provide for methodological help in order for such screening programs to take place. Let me be, they have proven their efficiency throughout the whole world based on WHO information. But for that, of course, you need professionals. It seems that here at this panel session, we are talking not enough about professional training, although at the Ministry of the level of Ministry, we talk a lot about it. We have programs, and the national medical centers are called upon and are ready to provide it remotely. We're very appreciative of Veronika for the fact that during 3.5 years, every Tuesday and Friday, we have programs whereby we consider clinical cases whereby 60 regions are involved. Veronika Igorevna saw this herself, how regions connect to this program. Unfortunately, not all the regions, including the heads of the regions present here, participate in such panels. So we are ready to share this experience, and actually the cancer experts from Samara are very active participating, because we are familiar that in Samara your people, your colleagues are very strong. They're very the best professionals, as you can see. Now, what else though that I shouldn't forget? It is very important for us together. No, sorry for paging it over because I'm just quite worried. Infrastructure, right, sir. Yes, we should understand that the primary care finds itself in a predicament because we've got a certain personnel issue there. Just for comparison's sake, the primary care is short of 43% of professionals, while in big centers, like what you find in, in oncological center, 96.6% full. Roster full. Can you imagine? So that has to be somehow brought into balance. And you're quite right, digital technologies and an awareness of being able to find consultations, like we're talking about the setting up of reference centers, referred to by diagnostics, pathology experts, because we understand that this is not quite possible yet without having a pathological test. We're short of the proper number of pathologists, but again, digital solutions which are available, they can strongly ease this problem. Digital referrals do prevail currently in the developed economies, and so we're practically ready to have such centers set up as well. And of course, outpatient oncological centers, that a lot is currently being mentioned about. This is a very important structure which would enable, on the basis of a well-equipped institutional healthcare institution, to immediately right there to provide aid to a patient, narrowing the number of days up to a proper hospitalization, because that requires less than 14 days. So thank you very much. We, being the 2 oncologists and 4 institutions who are very deeply involved in various oncological program development, we're ready to participate in all of these programs. Thank you very much. Thank you, Dmitryevich. Of course, a substantial challenge to us is implementing the oncology program, because it is very comprehensive, it is very complex, and effectively we're like setting up an infrastructure from scratch, the one that we don't have yet in the country. And so these outpatient oncological services, we're supposed to create 400 centers like that within the next few years. We are setting up 18 reference centers related to the most complex research methodologies, computerized MRI research, and the essence is that both in digital mode as well as in the real mode, these centers are supposed to provide help to the regions. A number of regional offices already have the kind of a level that they themselves become reference centers, and that is something that we are working towards, and of course something that we mentioned in the very beginning of this panel. It is impossible without solving the HR problem to achieve the kind of indicators that would mean that the project is working. So alongside with that, we are working on professional training projects. We hope that we'll be able to effectively do it. Alexana Dropkina, she's the director of the Prevention Medicine Center. Could you please say a couple of words very briefly? Well, esteemed Veronika Igorevna and dear panelists and dear colleagues, yes, indeed, it is true that a very serious challenge is something that the primary medical aid is currently facing. And one should say that to the question that the minister raised, in what way the national medical research centers may help in implementing the projects, I would say that in every which way possible we can help, because in the national medical research centers, by order and the Minister of Healthcare decree dated October 2017, our basic functions have been defined, and these functions are to organize medical aid. This is a continuous audit that we do. This is the analysis of the HR situations, as well as providing for professional recruitment, the drug provisioning, and telemedicine. So, in as far as our medical research center is concerned, which is the prevention medicine and the primary aid, as well as the therapies, certainly, in the first place, like I mentioned, we have created the full regulatory prevention base, and so the challenge we face is an occupational assessment, because one should say that in as far as the new order of prevention checkups are concerned, we will have the order of things established. That is a bit of a challenge, but in this kind of prevention work, population prevention is going to be very important, because that is setting the course for a public health. Now, what is it all about? How this should be developed? This is what we're still debating, because we do have certain issues that we can share out so as to tell you how it will work. And I would like to call upon the governors and the vice governors, saying that the public health is not only our very important and necessary social function. This means also a very important economic indicator, because money invested into the public health will be fully recouped and much more in about 5 years, and that means also a certain saving. But I would like to assure you as well that the methodological support in terms of the remote healthcare, about telemedicine consultations, is always available at our national medical research centers, and it works 24/7. Thank you very much. Thank you very much, Oksana Mihailovna. Dear colleagues, we also have here a representative of the pharmaceutical businesses, Vadim Vlasov, the president of the Novartis group of companies in Russia and regional director of Novartis in the East and Central European countries. And I would like Vadim Igorovich to ask you, what is it that the business, socially mindful business, can help in running the national projects? Veronika Igorevna, esteemed Veronika, dear colleagues, good evening. Thank you very much for the opportunity to say a word. The Novartis group of companies supports and shares the objectives of the national healthcare projects, and our people work on various pilot projects with the leading Russian research centers in a number of problems, so as to improve the treatment to the patients suffering from CVS and oncological diseases. So let me quote a few specific cases. Based on the data from the Russian epidemiological trials, one of the leading problems in the modern cardiology in terms of its contribution to mortality is the chronic heart failure. Based on the Russian clinical guidelines, the number of such patients exceeds 12 million people, while the level of mortality from this particular disease is 10 times higher, the populational one, amounting to 6% a year. In order to treat this problem, there is a need to set up a comprehensive system of monitoring system with chronic heart failure. The key components here would be the interoperability between the inpatient-outpatient links, the ability to gather structured data on diagnostic and treatment, the program for the support of patients, and providing proper drugs to the high-risk cohorts. We have prepared a model to assess the possible results of such an introducing such systems. Let me note some of them. Mortality from CVS mortality can go down by approximately 18%. This will lead to an expected lifespan grow by 1.5 years. At the same time, optimization of hospitalization costs by almost a quarter would enable one to compensate for additional expenses for the drug provisioning. Second thing that I would like to note is the program that is proposed by Novartis to fight such oncological diseases as lung cancer, mammal cancer, skin melanoma, liver cancer, and leukemia. And I would like to draw attention to a few initiatives. One of the effective measures in primary prevention, which corresponds to the priorities of the federal project fighting oncological diseases, can be our social campaign Raise Your Hands, because it is aimed at informing population about the breast cancer and the importance of diagnostics. This program has already been introduced into some of the Russian cities and is ready to be further disseminated. Apart from that, Novartis is ready not only to contribute to production and organization of contemporary therapies, but also to diagnose specific mutations. In as far as this is concerned, we have invested more than 55 million rubles in 2018, which enabled one to verify diagnosis for 5,000 patients. Now, speaking about therapies, with the aim to improve the cost profile of the regional budget, Novartis proposed the drug provisioning to be distributed between the government, customers, and the businesses. During the co-financing environment, we have provided the Russian patient with a free therapy for the amount exceeding 150 rubles. Now, looking into the future, one cannot but mention a very quick development of the genetic cell therapy. Novartis was the first one to introduce into the clinical practices the technology of the customized therapy based on CAR-T approach. Today, more than 300 patients in 11 countries have been given such a solution, and we plan to register this treatment also in Russia. So sorry for reading this as a statement from paper. This is something that I rarely do, but I hope that it helped us to save a few minutes at such a late evening hour. So after that, I would gladly respond to your issues. We have the representatives of other pharmaceutical companies such as Sanofi, Johnson & Johnson, MSD, colleagues. Will anybody be willing to say a few words, just a couple of words? Just a couple of words, please. You know, just 2 minutes, please. Thank you very much, dear Veronika Igorevna, for the opportunity to speak. I will be very brief, and I would like to respond to the question that you raised about how socially mindful pharmaceutical industries and companies may help in resolving a very important task that we have been debating, which is entering into the 80+ club. We do appreciate the kind of improvement and change that we see in the healthcare system, which is improvement in accessibility, the innovative drugs to the patients, and that is undertaking a systemic approach in assessing the efficiency of the healthcare technologies, improving funding, and many other steps which already demonstrate the expected results. But at the same time, right now, whenever we look at the currently existing systems of including various products into the high-cost nosologies or LED, currently one of the basic criteria is the neutral effect over the budget. Well, understandably, this kind of criteria is necessary considering the current economic environment and funding resources. And here the pharma companies specifically are ready, and we make a proposal about the way how within the currently existing environment we can improve the affordability and accessibility to the innovative drug. But we need certain instruments for that, because sometimes the situation evolves in such a way where we're ready to reduce the prices even below the ones that we're currently considering as the minimum ones in terms of the reference countries. But at the same time, it is very important for us as manufacturers to avoid an erosion of price reduction upon the global markets that we're present in. And so in this sense, we have been coming up with a proposal, and the Foreign Investment Advisory Council has already submitted its proposals to the Russian Parliament, where we propose that pricing should be fixed based on the system that the reference prices work in the essential drug list, EDL, but with confidentiality being preserved. We're ready to offer lower prices so as to come up with an instrument which would enable us to do this. So here, your support of your core ministry would certainly be of great assistance to us in order to achieve it, so as to increase the number of patients who will be able to enjoy innovative drugs. Thank you very much. We will definitely discuss this, because you know that in the course of 2 years we have been trying to develop the risk sharing and certain other mechanisms, but this certain primitive mechanisms, because they have certain pros and cons. So we're ready to talk to you about it. Thank you. If I please, just very briefly. Thank you very much, Ekaterina Pogodina. I represent Johnson & Johnson, which is a manufacturer of the various pharmaceutical consumer products. So esteemed Veronika Igorevna, dear panelists, today a lot has been mentioned about important structural changes which already demonstrate tangible results. But for example, if we take a look at the statistics whereby innovative treatment measures are being introduced and based on WHO data, only within 10 years the lifespan as a result of introducing these methods grew by 40%. And without doubt, it is important to note here that Russia, by the way, was one of the pioneers in introducing this program 10 years ago, the program of high-cost nosologies, which is the revolutionary approach. We can see that the number of countries do follow this example, and I would say that the only thing that I currently would like to particularly note that over the 10 years, science hasn't been standing still, and new breakthrough technologies have been emerging, which at this current point in time are not in a position to as quickly enter into this program. So if we take a look at the experience in other countries, then here together we worked with Ernst & Young company, which analyzed the international approach to funding high-cost nosology products, where one can adopt certain approaches of how not to only include it, but to upgrade certain potential programs. And one other point that we can help with, being a big pharma, we mentioned it before, speaking about the corporate medicine, this is exactly the kind of a healthy way of life, and a certain stimulus to the corporate employees and their family members in order to employ all of the mechanisms and reflect upon that 85% and effectively prevent the diseases. We're ready to share this experience and all of the analysis that we have. Thank you. Thank you. Thank you very much. Yes?
Good evening.
Добрый вечер. Я представляю компанию МСД. Большое спасибо за приглашение. Являюсь многонациональной фармацевтической компанией. Самое лучшее, что мы можем поддержать программу, это через наши инновационные препараты и вакцины, на чем мы действительно сосредоточены с точки зрения разработок. Мы не только делаем это, проводя клинические исследования и доказывая эффективность, так как мы исторически делали, но также необходимо нам показывать и еще и ценность такого рода инновационных решений. Мы готовы работать с регионами, обеспечивая и делясь с ними нашим глобальным опытом, демонстрируя такого рода ценность подходов, но также и через то, что мы называем и еще систему оценки технологий здравоохранения. Это как раз вот тот способ, который мы можем поддерживать. Но также мы можем еще и...
So if a region decides to invest in healthcare, in that therapeutic area, in that innovation, we can look back at the value of that innovation and the impact on human capital and the larger economy for that region. So, but as the minister presented earlier, we're not going to achieve the 80+ club milestone and the life expectancy ambitious goals through just drugs and spending. We also need healthier lifestyles, right? So we as an industry can actually partner with other industries and the Ministry of Health to educate people about living healthier lifestyles and empowering with the tools to do so. It's interesting. You know, people love their children, they love their parents, hopefully they love their partners, you know, husbands and wives, but they don't love their health until they get sick. So I believe with digital technology today, we can come up with solutions, platforms, and programs that will educate people and empower them to do so. Thank you.
Спасибо большое.
Thank you very much. The last few slides, if I may, please. Dear colleagues and dear governors and all of the participants of the panel session, could you please put a few last few slides? Yes. I would like to say that certainly one of the most ambitious projects is the national project for the development of healthcare system, and we are about to start. There are certain core components which would enable us to effectively implement this project. However, every project has its beginning and its end. This project is developing until 2024, but what's next? The biggest task for this project is not only to improve the state of health of our people, but also to create the platform for the next stage of its development. And so right now it's quite obvious which are the areas that will take us into the futures if within the next 6 years we are in a position to achieve an active partnership in the person of our patients and our regions. We will educate and we'll inform them. We will incentivize them. We will develop the system of public health care if digital technologies take place, including the electronic gadgetry that this particular slide demonstrates. And this slide demonstrates the progression over the 10 years of the kind of devices which remotely can indicate the level of sugar in your blood. Right now, it's a lens on your eyelid, a little device which puts under the eyelid and nano capsules that you take in and maintains continuous monitoring of what's going on in a human body. And so by 2024, we will be able to come up to a situation where the people in the risk groups in the first place will be in a position to continuously transmit information into the big cloud on the basis of depersonalized data and using intellectual software to provide guidelines to each individual about how to correct their lifestyles, how they correct their risk factors, and in case for the need to call a doctor, send a signal that a doctor should be visited. Next slide, please. And so in this way, we will be witnessing the processes of how the architecture of the healthcare system evolves from the current hierarchical three-tier system. We would arrive into a networking digital system where every individual will be the center of it, relying upon the proactive social groups and communities, including social workers, psychologists, insurers, etc. And that would enable us to liberate resources, to improve the quality of the high-tech aid, which will be rendered as an emergency and on schedule. And moreover, the system will help us to make all of the management processes transparent, including resources and processes, and the system will be effective in the resources that comprise it. And what academician Lichtau stated, the system would enable us to maintain electronic benchmarking so as to assess the timeliness and the quality of every individual case of healthcare aid. Next slide, please. Already now, in Russia, we enjoy contemporary, breakthrough, pioneering technologies. We didn't have them several years ago. Now we do, and they're being developed in a very active way, and they're going to be implemented. Moreover, our national healthcare project should prepare the whole country in as far as infrastructure is concerned, accessibility, transportation, in order for these contemporary technologies to grow roots. This is the genome therapy and genetic therapy, We have the drugs to treat various muscle diseases and some others. This is a targeted therapy which is broadly applied in oncology treatment. Next slide, please. This is regenerative technology, which enables one to develop from one's own cells various tissues on the basis of 3D printing, on the basis of other methodologies. Next slide, please. This is Nano Technologies, because today we already use nanocapsules in order to in a targeted way to deliver medicine to a human tissue. But in several years, nanorobots or nanobots will destroy the cancerous and various other tumors. The biotechnologies were already leaders in terms of the cochlear implants, which only 10 years ago, for the first time, were launched in this country. This is effectively a substitution of one's own hearing function. During the past 18 months, we've been able to introduce the cork vision to come instead of a living eye. We work with a bionic solutions, neurocomputerized interface, managing thinking process, the exoskeletons, which effectively make it possible to activate the hidden areas of the human brain. And this is augmented reality, which is being used now during surgeries, during rehabilitation, and in various training centers when doctors go for their professional upgrading. And robotics. Last year, a robot was patented in Russia, which, in terms of its capabilities, is better than Robert da Vinci. Next slide. In this way, we're currently accumulating and actively developing the technologies which, in several years, we will be ready to replicate and introduce, which would enable us to substantially extend the curve of life at the expense of all of the basic periods, like childhood, adolescence, adulthood. Indeed, healthcare from healthcare of treatment will transform itself into the healthcare of support. How? So that in a prenatal stage there would be a genetic diagnosis performed, and if there is a need, certain genetic adjustments could be done. During the time of birth, the ontologic material tissue will be collected, analyzed, and that would be the kind of a reserve of capacity for regenerative technologies to be called upon if something happens to a human body. At 3 years' time, when microbiotic environment is being developed, that is something that we would be able to use, transport, and store, and change. And one of the most important aspects, as from the early childhood, education and upbringing, which will help a person to be optimistic, to enjoy a higher level of empathy and responsibility for one's health. This is the kind of trend without which we won't be able to manage this task at all, and we should remember that all diseases first come in a certain visionary projection in one's mind, and only then manifest themselves through a protein construction, which is what we call our body. Right now, we are on the verge of a real breakthrough leap towards prevention and improvement of the healthy way of life. And at this optimistic note, let me wrap up this session. The period of 6 years would enable us from a different level to enter into the future healthcare. Thank you.